Improving Exterior Wayfinding in Elderly Communities by Noah Bapat, Ismael Frausto Leija, Elliot Schneider, and Caleb Waldrep. Age-friendly communities are more important now than ever in the United States. From 2010 to 2020, the number of Americans over the age of 65 grew to 55.8 million, which is an increase of 38.6% in just 10 years. When we consider this exponential growth, it is obvious that more consideration needs to be used in the treatment and housing of elderly people in America. An important area that needs to be considered is how old age can affect elderly people's directional awareness and how that affects accessibility and the well-being of the elderly. That is why our group proposes this question. How can we promote accessibility through wayfinding techniques? Our group decided to research topics more closely related to path usage and accessibility in elderly communities. Before conducting experimentation, we gathered general information about topics such as unique needs, sound interpretation, color, transitional spaces, and the overall safety and security within a community. We took information from Building Without Barriers for the Disabled by Harkness and Groom, as well as Site Planning and Design for the Elderly by Diane Y. Karstens, both giving insight to what elderly individuals require in their communities.
Unique needs. Homes for the elderly present specific challenges that are catered toward the special needs of the resident within these homes. The design for elderly homes must take into consideration many factors, such as more extensive care for the elderly more in need and more challenging designs for the more able-bodied residents. The contrast of supported versus individual living and the bridge between the two are vital steps in the design process. Sound. Older individuals perceive and process sound differently than younger people, so paying attention to where and how you can use sound in the design process in relation to the needs of the elderly is important. For example, an outdoor social area with music would be more beneficial to older people if the music played included more uniform and lower pitched sounds. Color. As residents' age changes and their perception of color and other visual elements begin to occur, this means that elderly are less likely to distinguish darker, cooler colors compared to brighter colors within the orange, yellow, red spectrum. Transition. Other people have many different needs that vary between each patient, so not all residents are capable of certain challenges that may be presented by venturing outside. However, this is not to say that they do not wish to connect to nature. With this in mind, transition areas become yet another important piece of the design process. Transition spaces allow patients to get close to nature in a low-risk environment. Older people also have a reduced ability to adapt to sudden changes in temperature, so this area allows them to gauge outside temperatures compared to their own. Safety. As people age, their fear of crime increases and personal security diminishes. Property of the elderly often has irreplaceable sentimental value, which is why it is important that they feel seen and are able to be aided in outdoor areas. Methods to promote a sense of safety and security include effective use of prospect and refuge, a clear transition of public spaces to private ones, clearly defined edge conditions, and clear surveillance of the immediate surroundings. Detailing also amplifies these, such as good lighting, ample seating, low bushes and plants, handrails, and emergency cell phone boxes.
For our empirical research, we divided the experiments into two sections. We did a behavioral research study and an interview. So for our study design, we had a focus on existing elderly communities. The behavioral observation was recorded on site at Five Points College Station and Fortress Nursing and Rehabilitation, while the path wayfinding revision was done on Longhorn Village in Austin, Texas. The study design gave us an enhanced understanding of how the elderly react to their communities, and then taking this knowledge to redesign more closely to their needs. In terms of method for behavioral observation, our group visited Five Points College Station and Fortress Nursing, gathering information on the building's accommodations for residents and other general information. The other experiment at Longhorn Village included an interview with the lead supervisor within the community and taking these findings from this interview to reimagine the community's design for exterior pathways. These two maps show how those findings were implemented into redesigning the exterior pathways at Longhorn Village. Before, A lot of the paths were very linear and did not offer many shortcuts or shade. After we added a lot of crosswalks, benches, trees, and shortcuts just to create a much better and easier accessible environment for residents in the community to walk around outside.
Through our behavioral observations, we found that 5 Points and Fortress Nursing had many differences in terms of their internal layout. 5 Points had a series of positives, such as clear circulation with no dead ends, large windows towards natural spaces, even lighting, and a plethora of spaces for residents to socialize. On the other hand, Fortress had a more confusing interior layout, with hallways being confusing and unclear. There was also very uneven lighting, as dark spaces would clash with very bright open areas, creating an uncomfortable setting for residents. Between the two, there is a common ground for improvement. Both lacked means of signage, making it very easy to get lost. Exterior sidewalks were also lacking or missing entirely, giving residents hardly any opportunity to explore outside the premises of their community. After interviewing with the lead supervisor at Longhorn Village, there were many concerns towards the existing exterior pathways for residents. Sidewalks were too narrow, lack shortcuts, and are often confusing to follow. Many of the sidewalks are uneven, which have caused residents in the past to suffer injury as a result. Lighting was also an issue, as residents lacked proper lighting in the morning, making it difficult for them to visualize their path of choice. Combining information from the behavioral research and the interview, Longhorns Village exterior pathways were redesigned to accommodate for many of the problems areas discussed. Many shortcuts were added in the areas that were very linear, giving residents a choice to change their trajectory at any given moment. Benches were also added alongside pathways, especially within areas as far as distances from the complex. This ensures that residents have access to rest stops when going on longer walks. Crosswalks were added as well, giving residents safer opportunities to cross the streets. Finally, the addition of trees ensured that residents would be comfortable at any given point of their walks, as the heat in Texas can be a substantial risk for residents who choose to venture outdoors in the summer. In conclusion, both of these experiences gave us greater insights towards improving exterior pathways through wayfinding techniques. The behavioral observation and interview were key in developing new and improved pathways for an existing LRD community and can be taken as inspiration in redesigning other communities in the future.